We're going to take a look at the neural regulation of ventilation and also look at the chemoreceptors. There are several respiratory centers in the brainstem that set the respiratory rate and depth of breathing. There are several things that influence the respiratory centers. The cerebral cortex, you do have some voluntary control over your respiratory rate and depth. The hypothalamus with the limbic system, the emotions can actually change your respiratory rate and depth. So for example, when you get angry, you'll start breathing faster. There are a few chemicals that also influence the respiratory centers in the brainstem. We'll look at the partial pressure of carbon dioxide, pH, and the partial pressure of oxygen. The stretch of the lungs, this doesn't come into play very often, but if you take too big of a breath, there are some stretch receptors in the lungs that will tell the brainstem that, hey, you're breathing too deeply. Irritants will make you cough, and then the muscle and joint proprioceptors that are telling your brainstem the position of the limbs. When you start exercising, the respiratory center is going to respond by increasing the respiratory rate and depth, and part of that information, how it knows you start exercising, is because of these muscle and joint proprioceptors. In the brainstem, there are two sets of neurons, the inspiratory neurons and the expiratory neurons. The inspiratory neurons are going to stimulate somatic motor neurons, which are going to stimulate skeletal muscles to cause inhalation. So through the phrenic nerve, that will tell the diaphragm to contract, and the external intercostal nerve will be stimulated to tell the external intercostal muscles to contract. And that will expand your chest and cause inhalation. The expiratory neurons will stimulate expiratory muscles to contract in active breathing, like when you're exercising and you need to intake or exhale more air. They will stimulate your internal intercostal muscles and abdominal muscles, and they also will inhibit the inspiratory neurons. There are three different respiratory centers in the brainstem, in the medulla oblongata and the pons. You do not have to memorize any of these respiratory centers, so just know that they're located in the medulla oblongata and the pons. That's all you need to know. Here's a picture of the respiratory centers. There's one in the pons, and then there's two that are in the medulla oblongata of the brainstem. And this other picture on the right, you can see how neurons that are in these respiratory centers will go down the spinal cord and synapse with lower motor neurons that will then go out through the phrenic nerve to innervate the diaphragm, tell it to contract, and also stimulate the external intercostal muscle to tell the external intercostal muscles to contract. So that will expand your chest cavity and cause inhalation. Here's the activity of the inspiratory neurons in the respiratory centers in the brainstems. It's interesting that they ramp up their activity and then all of a sudden they shut off. So what they're doing is they're firing action potentials more and more frequently, and that will cause, for example, the diaphragm to contract harder. And then all of a sudden, those inspiratory neurons in those respiratory centers in the brainstem, they stop firing, and that will stop stimulating the diaphragm to contract, and then it will just relax. And remember, exhalation is a passive process as the diaphragm and external intercostal muscles relax. This is a comparison of breathing at rest versus breathing while exercising. When you exercise, you need to move a larger volume of air in and out of the lungs at a faster rate to keep up with the demand of the tissues. So you can see that the phrenic nerve and external intercostal nerves are going to be much more active in telling those muscles to contract harder. And then also we're going to recruit the expiratory neurons to tell the internal intercostal muscles to contract, and that will exhale more air, so you can move more air in and out. There are two types of chemoreceptors that will send information to the respiratory centers and let them know what the levels of the partial pressure of carbon dioxide, pH, and if the partial pressure of oxygen is getting too low. The two kinds of chemoreceptors are the central chemoreceptors and the peripheral chemoreceptors. The central chemoreceptors are located in the medulla oblongata of the brainstem, and they just respond to the partial pressure of carbon dioxide. The peripheral chemoreceptors are in the carotid bodies, which are located in the carotid arteries, and they respond to the arterial pH, partial pressure of carbon dioxide, and very low levels of partial pressure of oxygen. So it's really important to star this. The partial pressure of carbon dioxide is the most important stimulus for controlling respiratory rate and depth. So make sure you know that. That's really important to know. You would think it would be the partial pressure of oxygen being the most important, but it's actually the partial pressure of carbon dioxide. And that's because remember that carbon dioxide affects your blood pH. And if your blood pH gets out of the normal range, you're going to die very quickly. So the body decided that the partial pressure of carbon dioxide is much more important than the partial pressure of oxygen. And so that's what it responds to the most. That's the most important stimulus for controlling respiratory rate and depth. Let's take a look at the central chemoreceptors in the medulla oblongata and the brainstem. They respond to changes in the blood partial pressure of carbon dioxide indirectly. And that's because the carbon dioxide in the blood will diffuse right across the blood-brain barrier and right into the cerebrospinal fluid. The cerebrospinal fluid contains the enzyme carbonic anhydrase, which is the same enzyme we talked about inside the red blood cells. The carbon dioxide, once it gets into the CSF, will be converted over into hydrogen ions and bicarbonate ions. The hydrogen ions are going to bind to the central chemoreceptors, and then those sensory neurons will stimulate the respiratory centers. The central chemoreceptors do not respond to the hydrogen ions that are in the blood though, and that's because the hydrogen ions are hydrophilic and they can't cross the blood-brain barrier. But the carbon dioxide, because it's hydrophobic, it can go right across that blood-brain barrier and get into the CSF. So let's answer these questions down here. So let's say that the blood partial pressure of carbon dioxide is too high, it's increased. So if you have too much CO2, then that will push the reaction to the right. And that will increase the number of hydrogen ions, which will make it more acidic, which will decrease the pH. So the central chemoreceptors will send messages to the respiratory centers, and the respiratory centers will respond by increasing the respiratory rate and increasing the depth. So you're going to breathe faster and deeper. And the reason that you get that response is that you have too much CO2 and you want to get rid of it. You want to exhale it. So by getting rid of that CO2, you're going to drive this chemical reaction to the left. So it'll go in the reverse direction. And if you go to the left, notice that your hydrogen ions, which you have too many of, on the other side, they disappear. So that will help bring the carbon dioxide levels back down to normal because they were too high. So maybe you were took too many opioids and breathing too slow and shallow to get rid of enough CO2. And so increasing the respiratory rate and depth will exhale the extra CO2, and then also it will increase the blood pH, which was too low because you had too many hydrogen ions. So that will help get rid of the hydrogen ions too. And then the last question, what if the blood partial pressure of carbon dioxide is decreased? So maybe the person is hyperventilating, breathing way too fast and too deep for the situation. So they're going to be exhaling too much CO2. So if you're exhaling too much CO2, that's going to drive this reaction to the left. And if you're going to the left, notice that your hydrogen ions, by the time you get over to the left, have disappeared. So you have fewer hydrogen ions than you should have, and that will increase the pH. And so that will tell the central chemoreceptors to send messages to the respiratory centers that, hey, we need to breathe slower and more shallow. And if you breathe slower and more shallow breaths, that will allow the CO2 to build up because you're not going to be exhaling it as much. And so that will increase the partial pressure of carbon dioxide, which will help fix the decreased blood partial pressure of carbon dioxide. And then also by increasing the carbon dioxide, we're going to make this reaction go to the right. And that'll increase the number of hydrogen ions back up to normal. So they were too low and now we're going to increase them and get the blood pH back to normal. Here's a picture of the central chemoreceptors that are in the medulla oblongata. So these sensory neurons are going to respond indirectly to the partial pressure of carbon dioxide in the blood. So carbon dioxide is hydrophobic, it just diffuses across the blood-brain barrier, and then it will combine with the water in the CSF. That carbonic anhydrase enzyme is present, and then we'll convert the carbon dioxide into bicarbonate ions and the hydrogen ions. And then the hydrogen ions are what bind to the central chemoreceptors in the medulla oblongata. And then they'll send signals to the respiratory centers. Notice that the hydrogen ions that are in the blood cannot cross the blood-brain barrier, and so the central chemoreceptors can't respond to the blood pH or the hydrogen ions that are in the blood. The other type of chemoreceptors are the peripheral chemoreceptors. They're located in the carotid bodies, which are in the carotid arteries, and they're in direct contact with the arterial blood. They're going to be responding mainly to changes in the blood pH, and blood pH will be changing because of the partial pressure of carbon dioxide, or maybe other acids are being produced in the body, like maybe you're exercising and producing lactic acid. So let's take a look at a picture and we'll answer these questions on the bottom here. This picture shows the location of the peripheral chemoreceptors. They're located in the carotid bodies at the bifurcation of the carotid arteries. And then right below that in this carotid sinus as well, we have the baroreceptors. And those are the sensory neurons that detect the blood pressure, and they're involved in the baroreceptor reflex. All right, so let's answer these questions. So if we have a decrease in the blood pH, that means that we're too acidic, we have too many hydrogen ions. And if we have way too many hydrogen ions, we can actually fix that problem with the blood pH by changing our respiration. So the response would be to increase the respiratory rate and increase the depth. So you'd breathe faster and deeper. And the reason you would do that is you want to exhale more CO2. And if you get rid of more CO2, that's going to drive this reaction to the left. And if you go to the left, notice that those hydrogen ions disappear by the time you get all the way to the left. And so that will fix the problem of having too many hydrogen ions. The hydrogen ion levels will drop, and that will increase the pH back up to normal. If you have the opposite problem, where the pH is too high, which means that the number of hydrogen ions in the blood is too low. So you want to increase the number of hydrogen ions so you can get the pH back down to normal. So the respiratory centers are going to respond to fix the blood pH by slowing the respiratory rate and taking more shallow breaths. So you're going to breathe slower and more shallow, and that will allow the carbon dioxide levels to build up because you're not going to be exhaling as much. And if you have more CO2, that will drive the reaction to the right. And notice that when you go to the right, you make more hydrogen ions. And that will fix your problem where you had too few hydrogen ions, and now you can get the pH back down to normal. And then also just going along with this, if you're looking at the partial pressure of carbon dioxide levels, if the partial pressure of carbon dioxide is too high, so you've got too much CO2, that will drive the reaction to the right. You end up making too many hydrogen ions, and if you have too many hydrogen ions, that will decrease the blood pH or make it more acidic. The respiratory centers are going to respond to try to fix the carbon dioxide levels and the pH by increasing the respiratory rate and increasing the depth. So you're going to breathe faster and deeper. And if you breathe faster and deeper, you're going to exhale more CO2. That will drive the reaction to the left. And notice that when you go to the left, those hydrogen ions, which you had too many of, will disappear by the time you get over to the left. And so when the CO2 levels are too high, if you breathe faster and deeper to exhale more CO2, that will get the CO2 levels back down to normal. And then also by driving this reaction to the left, you get rid of the hydrogen ions, and that will fix our problem with the pH being too low. It'll bring it back up to normal. And then the opposite problem, if the partial pressure of carbon dioxide is too low, then that's going to drive this reaction to the left. So hydrogen ions will disappear as you go to the left, and if you have decreased hydrogen ions in the blood, that'll increase the blood pH. So now it's too basic. So respiratory centers will be stimulated, and their response is to decrease the respiratory rate and decrease the depth. So you're going to breathe shallower and slower. So by breathing slower and more shallow, that will increase the CO2 levels back up to where they should be because they were too low. And then that will drive the reaction to the right, and we're going to make more hydrogen ions. And if we make more hydrogen ions, that will correct the blood pH and bring it back down to normal. So make sure you understand how the respiratory center is going to respond to changes in blood pH and partial pressure of carbon dioxide levels, because I will have a question on the test that will ask you this. And if you have this equation memorized, it will greatly help you, so you can decide which direction you need to go with the breathing and the respiratory depth. The peripheral chemoreceptors, besides responding to partial pressure of carbon dioxide in the blood and the blood pH, will also respond to very low levels of partial pressure of oxygen in the blood. In the systemic circuit, the partial pressure of oxygen in the arteries is normally at 100 millimeters of mercury. But you can see that as the oxygen levels get lower and lower, the minute ventilation increases. And remember, the minute ventilation is how much air is moving in and out of the alveoli per minute. And that's calculated by multiplying the respiratory rate times the tidal volume. So especially when the partial pressure of oxygen gets below 60, you can see that the respiratory rate and the respiratory depth is really going to increase. So you start breathing a lot faster and a lot deeper to try to get more oxygen in. This graph shows the effect of the partial pressure of carbon dioxide in the systemic arteries on the respiratory rate and depth. So the partial pressure of carbon dioxide is going to be sensed by both the central and peripheral chemoreceptors. So they're both going to be sending messages to the respiratory centers in the brainstem. And notice that a very small change in the partial pressure of carbon dioxide will very quickly cause a change in the respiratory rate and depth. So as the partial pressure of carbon dioxide levels increase in the arterial blood, notice that you're going to be breathing a lot faster and a lot deeper because your body is trying to get rid of all of that extra CO2. But unfortunately, maybe you're breathing in 100% carbon dioxide and you can't get rid of it. And so all of that extra CO2 will push the reaction to the right, and you're going to be generating lots and lots of hydrogen ions, so your blood pH is going to get very acidic. And as your blood pH gets really acidic, at a partial pressure of carbon dioxide greater than 90, you actually go into a coma. And that's because the acidic blood pH depresses the neurons in the brain and they don't work very well. And then notice as the partial pressure of carbon dioxide goes above 90 and gets even higher, notice that the respiratory rate and depth starts to slow down. And that's because the respiratory centers in the brainstem, those neurons are now being depressed, and then eventually they will stop working and you stop breathing and you die. This is a nice flowchart that shows both the central chemoreceptors and the peripheral chemoreceptors and what they respond to. Remember, the central chemoreceptors and the medulla oblongata are going to be responding indirectly to the partial pressure of carbon dioxide in the blood. So the carbon dioxide diffuses across the blood-brain barrier into the CSF and then gets converted into hydrogen ions. And then the hydrogen ions will bind to the central chemoreceptors and they will send signals to the respiratory center. So if the partial pressure of carbon dioxide is too high, that ends up creating too many hydrogen ions, and the response of the respiratory control centers will be to breathe faster and deeper to get rid of the extra CO2 and then also get rid of the extra hydrogen ions. The peripheral chemoreceptors that are in the carotid arteries They respond to three different things. They can respond to the partial pressure of carbon dioxide in the arterial blood. They can also respond to the hydrogen ions that are in the blood. And then also they respond to the partial pressure of oxygen when it gets really low. So again, the most important stimulus for breathing is the partial pressure of carbon dioxide. Let's take a look at hypoventilation. Maybe the patient took too many opioids, and opioids will suppress the respiratory centers. So you're going to be breathing too slow and too shallow to meet your tissue needs. And if you're breathing too slow and too shallow, you're not exhaling as much CO2 as you need to, so the CO2 levels will start to build up. And when CO2 levels build up, that will increase the hydrogen ions and make it more acidic and decrease the pH. And then also the arterial oxygen levels will decrease because you're breathing too slow and too shallow as well. But again, the most important stimulus for breathing is this partial pressure of carbon dioxide. That will be detected by the chemoreceptors along with the hydrogen ions. And if the oxygen levels get really, really low, the peripheral chemoreceptors can also respond to that. So in response to hypoventilation, the respiratory control centers will try to tell you to breathe faster and deeper. And hyperventilation, you're going to be breathing faster and deeper than necessary, so maybe you're having a panic attack. So your ventilation is going to exceed the tissue needs. So because you're breathing so fast, you're going to be exhaling lots of CO2, so your partial pressure of CO2 gets too low, and you're also breathing in more oxygen than you need, so your partial pressure of oxygen is too high. So the big problem is the partial pressure of carbon dioxide being too low. And if that's too low, that shifts this reaction to the left, and that will decrease the amount of hydrogen ions, making the blood pH too alkaline or too basic. And the respiratory control centers are going to respond to that by telling you to breathe slower and more shallow to let the CO2 levels build back up. You don't need to memorize this picture, but it just shows you that there's a lot of sensory input going to the respiratory centers in the brainstem, and they use that information to control the respiratory rate and depth.